to go over some virtual member benefits. We're really trying to change how we do certain things here at MassBio so that all the employees of our member companies see the value of membership. And I also want to say that I have Liz Steele, who's with us, who is MassBio's VP of Programs and Global Affairs. She's going to help moderate and guide the Q&A portion. I ask you to bear with me. This whole virtual IT world, I'm hunkered down all by myself here at MassBio headquarters, and I have been. I got to look at my wall right now for 21 days. We're in 21st day of working virtually here at MassBio. So I'm in charge of my own IT, and I must admit I'm not very good at it, but I'm learning so much. So first, let me start off with the supply hub. And this goes back to a few weeks ago when the epidemic, when the pandemic was on its way. We were fielding at MassBio, as you can imagine, lots of questions, lots of requests from hospitals. Our partners in the healthcare industry were looking for supplies. They were looking for test kits. There was all sorts of needs that they had. And as we were fielding those questions, folks from government at the same time were reaching out, whether it was to folks on the MassBio team or myself, and looking for information to get in touch with the CEO of this company or the CEO of that company. And we quickly realized that from a supply chain standpoint, and living in a world of just-in-time inventory, we really didn't have adequate supplies. And due to the cracks, several cracks that we've identified in our supply chain, due to the fact that a lot of our products, a lot of our PPE, et cetera, a lot of the materials for things that we manufacture here in the US come from other parts of the world that have already been adversely affected by the virus. So there was some serious issues getting materials, getting PPE, getting test kits. There's a lot of ventilator issues. So the fact that we were trying to handle and manage all of this, it became very daunting. So it was 2 weeks ago yesterday that we decided at MassBio to pull together our partners at the Mass Health and Hospital Association and the Council of Boston Teaching Hospitals, and then also pull in our partners at MassMedic. The four organizations got together and we felt that Mass Health and Hospital Association and the Council of Boston Teaching Hospitals would be able to really pull together the needs of their members. What is it exactly that they're looking for, from swabs to booties to visors to shields and goggles, et cetera. And then on the flip side, working closely with MassMedic, we felt that we could get a message out to the 2,000 life science companies that are here in Massachusetts. Can we get a survey out to them and inventory what it is that we had for supplies here in Massachusetts? We're looking short term. We weren't working on what we could order and get in 8 weeks, 12 weeks, or 2 months. We were really working on what was here in Massachusetts, especially as it relates to masks, swabs, gowns, et cetera. The stuff that we have in our clean rooms, stuff that we have in our supply closets at our member companies that we could spare to make available to the amazing men and women, the heroes who are healthcare workers on the front line. They need this stuff and they need it fast. And again, we're still not at the peak of this. We're about 12 to 18 days away. But I'm happy to say that we came up with the idea of the Massachusetts Life Sciences Emergency Supply Hub. And we were able to build the supply hub out, which is really a survey that would inventory all of the supplies that we have in Massachusetts, and at the same time, pull in all of the needs that were out there. So in a sense, we built a portal that would match up needs, the wants, with the haves that were out there. And we did this in conjunction with the command center. We're not doing anything here at MassBio or working with our partners to build out the supply hub that would replace what state government was doing. The amount of communication that we've had with the command center under the leadership of Secretary Mary Lou Sutters and her team and the folks at MEMA and everybody in the administration, and not just the administration, also working very closely with the Attorney General and her office, we're able to pull together this information and provide it real time to the folks in state government, in the command center, and they would then decide based on need where the materials would go. So, I'm happy to say there's a lot more detail we could get into there, but we stood this thing, we built it in 24 hours, stood it up on Thursday, March 19th or 17th, and then, or no, 19th. And then by March 20th, we were actually with the governor, standing alongside the administration, announcing the supply hub. And just within the first 24 hours, we got over 200 companies to volunteer or to donate and inventory and donate or make those materials available. I'm happy to say that to date, we have well over 500 companies participate, small, medium, and large. Many of the larger companies have gone out on the outside of the supply hub and made big shipments available to MEMA, so MEMA could distribute them to the hospitals and caregivers based on need. And it was truly, truly an amazing 2-week effort to stand this up. We also were collecting inventory, not human inventory. We're collecting the names and licenses, name, rank, and serial numbers, would stay in the military, of the folks who could be our second line of defense. In our industry, we have so many certified lab technicians, pharmacists, registered nurses, NPs, MDs, and these folks have been making their information available as well to the supply hub. Since then, we've realized that it probably didn't make the most sense to mix the human resources with the PPE and the supplies and whatnot. So we've partnered with Life Science Cares, and they've put a survey out that's more specific towards human resources and folks that are willing to volunteer when those amazing healthcare workers on the front line are, when and if they're fatigued and or illness strikes, we need to have back up a bench to come in. And I'm happy to say that that's been very effective as well. Over this past weekend, the state actually built out a portal that has 3 components to it. One component is the PPE, the supplies that are available. So if any of you folks still have supplies, we're transferring everything that we've done in the past 2 weeks, now that the state has had time to build up their command center and they've had time to build out a team to manage this. Their new website, their new portal for PPE, as well as people that want to place orders or bid on work, people that have distributors, manufacturers, people that want to get involved and bid on making these materials for the Commonwealth. There's a section of the portal where they can fill out their information there as well. And then the third component to the new state portal has an area for volunteers to register. So we'd ask all of you, moving forward, anything that's in the supply hub, the MassBio team working up with our partners will continue to make sure all of that is addressed. But moving forward, if your organization has any other PPE, supplies, or personnel, visit mass.gov/COVID-19 and fill out the information there. I'll say it again, and we'll provide this to everybody on the virtual town hall as well afterwards, and it will be available on our website, mass.gov/COVID-19. So please, let's continue to that. We want to thank our partners at Mass Health and Hospital Association, Mass Medic, Council of Boston Teaching Hospitals. I mean, they've truly been amazing to work with. And most of all, you know, we need to thank the people who are on the front line. This is a perfect opportunity of all of us in the life sciences industry to really stand up and help the frontline healthcare workers. I mean, we go to work every day to solve unmet medical need and treat the underlying cause of disease, and in some cases cure diseases, right? That's an amazing thing to do. But right now, the folks that actually care for patients on the front line that need our help. So we're going to continue to do everything we can to encourage our member companies to donate through the state, and we hope that all of you will as well. I mean, especially right now, N95 masks and gowns, there's a huge need there. The amount of supplies that the healthcare workers go through as they're treating patients for this virus is extraordinary. It's unlike anything that we've ever seen. So please, let's continue to focus on that, because tougher days are ahead of us as we go through this process. Also related to COVID-19, MassBio has partnered with MIT for their MIT COVID-19 Challenge, which is a series of virtual hackathons that are going to start on April 3rd. Where virtual teams, they're going to tackle the most critical scientific needs caused by the outbreak And you can find more about this MIT hackathon at covid19challenge.mit.edu. Again, covid19challenge.mit.edu. That's enough for the Supply Hub. I'll take a breath here. And that's really what we've been up to for the last couple of weeks. I look forward to talking more about what we're going to do the next couple of weeks. But why don't we get to some Q&A? Liz, do you want to see if folks have any questions?
Sure. So we are encouraging everyone to add their questions via the Q&A function. So if you hover at the bottom of the screen, you'll see the Q&A, and just type your question, and you can upvote other people's questions so that Bob can answer the ones that are the most pressing.
And while we're waiting for a question, I want to let you know that I actually shaved today and put on a tie for no reason other than this call. And it feels really good to put a tie on again and shave my face because, like I said, it's been 21 days here in isolation.
Okay. All right. So we're still waiting for a few questions. In the meantime, Bob, I can ask you a question. Are
Yes.
you able to update everyone watching about the status of MassBio events, the big ones, the small ones, kind of what's going on with that?
Yeah, the way we look at it here at MassBio, and we started this this mantra, this thought process a few weeks ago, we're not canceling anything. We're postponing things. So if you look at the State of Possible conference, the MassBio annual meeting and State of Possible celebration, that would have been next week. And we're not having it. We've postponed that to August. When is it, Liz? What's the date on it? Oh, you got to unmute.
I believe it is August 26th and 27th. It's a Wednesday and Thursday.
Yeah, so we're going to take our signature events. We're postponing them until after we get through all of this. I think we're going to be able to say that, August and September, are going to be the new March and April, right? So let's postpone things, and we're going to have a real busy summer and fall. And that's the fall's always been busy for us, but typically July and August were slower months. I don't think they're going to be for anyone this year because we're taking things and postponing them. As far as professional development forums, we're going to be going towards virtual events. So we're going to stay tuned, and you'll receive from us all the information as it relates to the virtual forums that we will be doing moving forward. And also I want to talk about the MassBio Hub. Some folks may say, wow, it's a pretty bad time to build a conference and meeting center. Well, yeah, it is pretty bad timing, but the only thing that we can do about that is any of the folks who are scheduled for, May and the latter part of April, if there were things scheduled, we're going to just postpone them. And we're working with our member companies that had bookings to put them off to a later date. And we'll probably, at the MassBio Hub, just be a little bit more busy in the fall than we anticipated, but that's okay. I think everybody's going to want to go and work a lot of hours because everyone's getting pretty tired of being pent up in their house.
Great. And we have one question. Bob, I'm not sure you're going to be able to answer this, but Alan wanted to know if we can help small companies with advice on how to navigate the programs under the CARES Act, or at least potentially direct them.
Yeah, we can, and that's fluid. We've got a policy call later today with our folks down in Washington, D.C. to go through the CARES Act here at MassBio. We're meeting with, our accountants to learn more about it and our banks. But, when you look at that payroll protection provision, if you're a small company and if there's a way you can utilize those loans to keep folks on the payroll, I think it's going to be a very, very, very helpful tool. We're going through it now. Stand by. We do have our policy team has sent out some information that we've gathered from folks who know a lot more about this than we do, but stay tuned. The intention of the CARES Act is to keep companies going, because what happens, and again, a lot of that are restaurants and folks in retail, small businesses, but think about our businesses as well. It's so important for our smaller companies to be able to continue to go, continue to keep our science going. That's why we worked very, very hard at MassBio to ensure that the R&D component of what we do in the pharmaceutical industry was exempt in the governor's shutdown order, because we wanted to be able to, we're not saying that we want everyone to go to work. We want people to work remotely as much as humanly possible, But if there are certain people that need to come in and make sure that animals stay alive and that science can stay alive, that's so important so that we have something to come back to when this is all done. But stay tuned. That's a great question. It's a fluid situation, but we feel that there'll also be another component of, a fourth component that comes out of Congress to support these companies. But we're working very closely with our entire delegation, and everybody's on the same page that we want to make sure that, the small to mid-sized companies is the lifeblood of what we do in the life sciences here in Massachusetts, and we cannot risk losing that. So we will fight tirelessly to make sure that you have the support that you need.
Great. And Marissa is wondering if we're going to have a recap of these town halls. Marissa, we will actually post the recording of these town halls on our YouTube page. So you will be able to see those. And Bob, these are going to be weekly, right? You're going to jump on every week?
Yeah, for the foreseen future, we want to do this at 11 o'clock on every Tuesday moving forward. We capped the amount of people that could participate today because like everywhere else in the country, folks have been having bandwidth issue on Zoom and many others. So we're trying to ease into that. Liz, do we have 100 people on board today?
We have 70 people right now.
Yeah, and we shut registration off at about 100. So for folks that weren't able to get on, we are recording it. We'll be able to play it back. But yeah, we're going to try to do this every week, and we'll grow it to the best of our ability based on what technology will allow.
Great. And while we wait for some more questions to come in, why don't we launch one of our very important polls that we are doing. So everyone will see a poll pop up. We really want to see how our members are coping in these uncertain times. So feel free to vote, and then we'll keep it open for a few seconds while we get a little bit more voting in there. All right, we'll give it about 5 more seconds. And if you've already voted, why don't you hover down at the bottom if you have any pressing questions and ask some questions. I know we all love to hear Bob talk, so why don't we pick his brain a little bit?
Yeah, that was a very generous statement, Liz. Thank you.
All right, 3, 2, 1. Let's see what our members are doing. Check the results. Wow, MassBio members.
A lot of exercising. That's great. Exercising and cooking and video chatting. It's unprofessional to disclose this. I didn't see that one. There you go, Liz.
No one is staring listlessly out the window. Everyone is being very productive. I like it. Great. Okay, so Bob, while we wait for some questions, why don't you tell us a little bit more about MassBio's virtual member benefits that we're launching? Okay,
so in addition to our efforts around COVID-19, which obviously we know is pressing, MassBio still needs to move forward, okay? So what we're gonna do is roll out a number of initiatives that will engage our members while you're all working remotely. First, we're going to continue to do the town hall meetings. I already said that, and we'll do that. That'll take place every Tuesday at 11 a.m. And what I may do, and let us know, and that's why this Q&A is ask whatever you want. If there's any people that you want us to bring on to the town hall to interview, we can do that. So, our goal would be if there's any real breakthroughs that are pertinent to our member companies, let's get those folks on and we can have a chat with them. Secondly, we're going to roll out virtual events similar to this one on a range of topics, from everything from the professional developments to the more updates on COVID-19. Maybe we'll do a forum that's specific to the wonderful question that was asked earlier as it relates to any federal legislation and any acts that come out of Congress to help us get through this. Third, we've launched a MassBio virtual community, okay? So now we want to have a virtual community. MassBio, it's all about the employees of our member companies. The way we get things done at MassBio is by pulling together all of the people that work in this amazing industry, whether it's our policy agenda, whether it's patient advocacy, whether it's social responsibility, whether it was a few weeks ago, it was transportation. Obviously, that's not an issue right now, but look what we've pulled together around. So we want to make sure that, everybody is participating in our, LinkedIn virtual community. So this group, it's private, but you can access it from the LinkedIn social image that's on our website or on the MassBio blog. So if anyone has questions about that, let us know. But we want to get as many people as possible into our LinkedIn community. And lastly, we have our MassBio rewards program, okay? That is part of the MassBio Edge, which is our purchasing consortium. We've added more savings to our rewards program that will include things that are virtual offerings for members to help companies navigate, the virtual marketplace. For an example for that, we used to have a reward, you could go to a gym. Well, people aren't going to gyms right now, so we've added to include virtual workout classes. We've had partnerships with the museum, so you can go to a museum. Well, you can't do that right now. Well, how do we have virtual museum tours and support for businesses during this time, and many, many more. So stand by for that. I'd say make sure that you have an account on massbio.org to take advantage of these benefits, and make sure you check out our blog. We're going to really beef up the blog and the links to all the resources that, I just mentioned. Because again, we want to make sure that all of you and all of our member companies can keep going, right? This will pass, right? But it's a very difficult time for everybody. So if there's anything that we can do as your trade association, we want to make sure that we embrace this virtual reality that we're living in right now, for good or for bad, and try to make it as good as humanly possible.
Great.
Want to do some more questions, Liz?
Yeah. So actually, Bo had a few questions, and he wants to, wondering about setting virtual social hours after the town hall. So
Wow.
Bo, our team is actually figuring out how to do it. So they won't be directly after the town halls necessarily, but we are figuring out how to continue the networking for all of our members so that you can see each other. And also, Bo, we can turn the chat back on. We had some difficulty with it in our first webinar last week. So we wanted to make sure that we were focused just on the Q&A for this one. We'll open it back up in the future. Bob, I have, Christiane has a question, and she said that they've been contacted by MEMA to donate PPE, but they hadn't heard anything about the other things, the RNA extraction kits, equipment, etc. Those are still needed and going through the state donation site, correct?
Yeah, absolutely. And if you visit our website, you'll be able to see a link to what, even on the state site, they should have listed all the things that are in need and that they're looking for. And again, spread the news as well for people in your companies who could donate their personal time as healthcare professionals if you have them at your company.
Great. And Bob, this is a very hard question to ask, but Stephanie wanted to know, how long do you think that we're going to be out of the office? She thinks her company's not going to return until May, but she's happy to work remotely. And I think a lot of our employees can do what they can do remotely. But if you had to guess.
I mean, I'm not qualified to answer that, but I guess I can guess, right? Based on what I'm hearing from CEOs out there, I mean, everybody's pretty much accepted the fact that April is out, okay? No one's coming back in April. Even the administration down in Washington, D.C. has come to that conclusion. I think that May is probably maybe the end of May, but I would expect what I'm planning for here at MassBio for our team would be hopefully June. We can get back, but I think there will be social distancing, through the summer as well to some sort of a degree.
Great. Okay, so if other people have more questions, feel free to add on. Well, let's do one more poll while we wait for a few more questions. Hold on. All right, and this is also, another really important thing that you know. If your current life is a movie, what category would it be?
So I don't see that, Liz.
No. It does not look like it popped out. All right, we're having a little bit of technical difficulty on that. All right, let's see if we can give it some time to reset itself. Figured it out. All right, well, we have, can you see it now? Technical.
No.
All right, so the question was, Bob, I'll ask you the question. If your current life was a movie, what category of movie would it be? Action, comedy, drama, horror, science fiction, or children's musical?
I think it would probably be a drama. It's been pretty dramatic the last couple of weeks. Just like I said, it feels like 2 years. It's been amazing around the clock because our industry plays such a major role in fixing this problem long term. It's been very busy from that aspect. When you think about where we play a role, not just our biopharma companies, but think of all of our research institutions and world-class academic medical centers and academic research institutions that are playing a role on what's going on right now. And you look at companies that have just completely shifted what their day-to-day was to address this problem, whether it's from a diagnostic standpoint, whether it's from a vaccine or an antiviral or whatever it may be. It's truly been extraordinary to see this huge shift. And it's something that, you know, at MassBio, it's our job to pull people together. We're not doing the science here, right? It's our job to pull people together and ensure that they're communicating. So I don't think we've ever been busier than right now. It was weird. It's a very weird feeling because, you know, a few weeks ago, we were coming into our busiest time at MassBio, March, with the St. Patty's Day celebration and the state of our annual meeting, the State of Possible conference, everything that's going on down in Washington, D.C. in March is just crazy busy for us. I thought when everything was getting canceled or postponed, because I don't use the word cancel, when everything was getting postponed, I thought that this would be a real good time to take pause and catch up, but it's actually been busier. And it's serious. It's you know, people's lives are at stake if they don't get the care. The best, you know, their best chance at making it through this are to get the best care they can, and people can't get the best care available if people don't have the equipment needed. So I've had a lot of sleepless nights thinking about what things are going to look like after all of this. And I truly think we're going to come out much stronger as a society and as a people and as a government and as an industry, because I don't think we'll ever let ourselves get in a position where we don't have more control over our own supply chain. This has been catastrophic. I mean, we manufacture in the United States of America, but a lot of the ingredients required and the materials and supplies and components for us to manufacture what we do are not made here. And we were not set up, we were not ready for this. But this is a talk for another time. Right now, we need to do what we have to do today and what we can control today. And that's what we're doing by pulling together everything that we have available, working with the federal government, working with our businesses here to see companies that aren't even in our space that are making masks now, companies like Reebok, and to see what companies like Philips and Medtronic and Thermo Fisher and so many of our companies here have pulled together to start doing stuff that they normally didn't do so we could get through this. And it's really, you know, it's tough times, but it's also, you know, what do they say? When times are dark, that's when stars shine the brightest. I think that's what we're doing right now. We're shining bright.
That was nice, Bob. Before we close, Carla, I think definitely the work from home will be, you know, adjusted in the future, and I think more companies are likely going to do it. Bob, I think you'd agree on that. And then also a different Elizabeth had an idea to survey our members, similar to the transportation survey, to see how they were pivoting, how they're planning to pivot and change given the current crisis. I think, Elizabeth, that's definitely something we can take back. And
yeah, that's a wonderful suggestion. Thank you, Elizabeth.
Great. And Bob, I know it's right at 11:30, and I believe that you have to run. So any parting words?
No, I just, you know, this is a difficult time. I just ask everyone, do your best to stay safe. The most important thing is your health and your family, and we'll get through this.
Great. All right. Thank you, everyone, so much. Bob, we'll see you next week.
Bye-bye. See you next week.